smears.
But it's not possible for a patient who's never been to Africa to have African sleeping sickness.
I'm just saying it fits the symptoms.
She could have got it from a transfusion.
Or I'm just saying she could have got it from a transfusion.
Which she never had.
Okay.
What about toxins?
No, the kitchen she works in is cleaner than some hospitals. But they do serve rabbit. Rabbit fever fits her symptoms.
Tularemia initially presents with a rash or ulcer near the infection site.
Not if she inhaled it. Chopping the meat with the cleaver could easily aerosolize the bacteria.
No, then she'd have respiratory symptoms.
Maybe she ignored it, figured she had a cold.
They rejected Lyme disease because the couple would have noticed a rash, but a wet hacking cough is just going to slip right by.
It's either that or she missed her exit on the turnpike and wound up in Africa.
Okay, two lousy ideas. Unfortunately, they're better than all the other ideas. Tularemia. Bizarre. Very nice. That's why I ride you.
Did he just turn on the TV?
He needs to think.
So this should tell us whether or not she's got rabbit fever.
For a diagnosis of tularemia, you need a 4-fold increase in serum antibody levels. To measure an increase you need a before, all we have is an after.
A single titer over 160 would be a big clue.
That's why I ride you. What does that mean? Even when I have a good idea, it's because of him?
Actually, I think he said your idea was a lousy idea.
It has to be one of these two conditions. I say we take our best guess and just start treatment, or treat both.
The treatment for tularemia can cause aplastic anemia.
How come he doesn't ride you guys?
He's got a crush on you. He just doesn't know how to show it.
Get over it, he rides everybody.
And the treatment for sleeping sickness kills 1 in 10 patients.
So we start with a safer treatment.
By safer, you mean the one that's slightly less likely to kill her.
Foreman got the gang testing for tularemia? Yep. Probably inconclusive, but worth doing. So, what's her name? When do I get to meet her?
There's nobody. Give it up.
Your lips say no, your shoes say yes.
Well, they're French. Can't trust a word they say.
Solid, yet stylish. A professional woman would be impressed. I'm thinking accountant, actuary, maybe. Like somebody in the hospital. Patient? No, chemo's not sexy. Daughter of a patient. She would certainly have the neediness you need.
I'm not going to date a patient's daughter.
Very ethical. Of course, most married men would say they don't date at all.
There was no date. I had lunch with one of the nurses. It's her first time in an oncology unit. She's having a tough time, emotionally.
Perfect.
I want it to be nice. That's all. I mean it.
You always do. It's part of your charm.
Hi, boys. Mrs. Campbell's test results. You remember her, the preschool teacher with the heart of silicone.
Nope, doesn't ring a bell.
They came in yesterday. I figured you guys would have been all over them. I know how concerned you were.
She's all upset because we paid more attention to the other girl. You check out her ass, I've got the chest.
The tests were normal. Of course, that's just my opinion. You might want to call a couple of guys from maintenance in for a consult.
You check her EKG results before she left the other day?
You ordered it.
You're the responsible one.
What's wrong? They look normal to me.
Where is she?
Waiting downstairs. Why?
I was right.
Do I have to get rid of the implants?
Surprisingly, no. But your EKG shows a slightly decreased heart rate.
Is that a problem?
You told me you hadn't changed your diet or exercise. Were you lying?
Lying?
Does your husband have high blood pressure?
My husband?
Yeah, you see, if you're gonna repeat everything I say, this conversation is gonna take twice as long.
Yes, he was diagnosed 6 months ago.
You do a lot of cooking at home?
Not really, other than oatmeal in the morning.
Did you happen to notice a slightly odd taste to the oatmeal lately?
Wait, are you saying that...
That it looks like your husband stirred in some